Still talking health, but virologists and epidemiologists in the country have called on federal and state governments to strengthen public health surveillance across borders and port services following the outbreak of Sudan strain of Ebola virus in Uganda. The experts called for increased awareness and urged that flights from areas where the virus had been reported should be monitored. A professor of medical virology at the College of Medicine, University of Lagos, Sunday Omilabu, said the fatality rate of Ebola is about 80% compared to COVID-19, which he said is only about 2%. Omilabu, who is also the Director, Human and Zoonotic Virology, College of Medicine, University of Lagos, urged Nigerians to be cautious and alert. Now, joining me on the news to discuss the state of Nigeria's preparedness for this virus is Medical Virologist and Lecturer at the Adeleke University, Ede, southwest of the country, Dr. Oladipo Kolawole. Thanks for joining us, Dr. Kolawole.
Thank you for having me on the news.
All right, of course, everyone remembers Nigeria recorded its first Ebola case in 2014, in which the country sadly lost Dr. Ameyo Stella Dedevo through, of course, the spread of that Ebola virus that time. It was contained also in that period, but do you think we've learned anything from that experience?
Yeah, I think if you can recollect vividly, there was a situation on ground, a condition on ground then, that did efforts to contain the virus that time. You know, we have the imported case of Patrick Soya then, and if you can recollect vividly, that time there was a strike going on by the medical doctors. So the public hospital was not functioning. So it made it possible for the imported case then to go to a private hospital before we lost that doctors and some nurses that time. So the bone of contention now is that we have more work to do than that time, because all our health facilities are actually in full function now. So, and we cannot compare that scenario with this scenario now. And if you look from 2014 to 2019, our population has increased. The number of air travelers have also increased. So we have more chances of importation of Ebola, we have higher than what we had in 2014.
Well, we're talking about more chances. The NCDC said it was following up with passengers from Uganda for about 21 days from their arrival in Nigeria on their health status. Do you think it's high time we started seeing other measures to also go to contain the spread of the virus?
Yeah, I think one of the things we need to do is to sensitize the community more, not concentrating on only air travel alone. It's not through air travel that we have passengers coming or foreigners coming to the country. We have the land borders too. So as we try to strengthen our port of entry like Lagos, Abuja, Kano, Rivers in terms of air travels, we should not neglect the land borders too to put necessary measure in place. And also we need to do what we call we have to communicate and engage the Nigerian population more to tell them about the signs, symptoms of Ebola virus and Ebola virus disease, so that it will be easier if you suspect any of this case, you can go to the appropriate health authority or health center for immediate testing, so that we can know the appropriate treatment to put in place.
Yeah, can you speak a little bit more about the level of sensitization, that is required, comparing, of course, the 2014 outbreak plus COVID-19 and all of that? What more levels of sensitization do we require? And also, is there a possibility of vaccine, disease, virus fatigue in 2022 in Nigeria?
Yeah, I think we need to put in more effort by using our radio, our television station, like what we're doing as part of sensitization. We have to roll out jingles. We have to get a good infographics in place so that it can stick to the memory of the Nigerian population that this virus is real, is nearby, and we have to be on red alert. And we should not take any symptoms for negligence. So we need to get to the appropriate hospital for appropriate treatment, appropriate testing. And luckily for us, during COVID-19, either one way or the other, our diagnostic capacity has improved. So it's most important for us now to put all those tools in place, not neglecting them, and make sure that it allows us to get and detect as early as possible. So if we can put that in place, it is easier for us to manage it at early point in time.
Dr. Kolawole, thank you for speaking with us. We look forward to bringing you up again.